Now, Executive Suite with WPRI.com reporter Ted Nisi.
5 years after Rhode Island fell into recession, the state is still struggling to come back. A rare bright spot, the healthcare sector. Led by nonprofit hospital group Lifespan, now the state's largest private employer. Hopes are also rising for a rebound at TF Green Airport, with a long-stalled runway expansion on the horizon and a new carrier, JetBlue Airways, coming this fall. One woman is helping to pilot both organizations' futures. This week on Executive Suite, Lifespan's Senior Vice President and Rhode Island Airport Corporation Chairwoman, Dr. Kathleen Hittner. Welcome to Executive Suite. I'm Ted Nisi. Dr. Hittner, thanks for joining me today.
It's a pleasure. Thank you for asking me.
Absolutely. Glad to have you. We were talking before the break, and I want to just dive right in on the changing healthcare sector. It's unbelievable how much is going on there. Atul Gawande, the medical writer at The New Yorker, recently had a fascinating piece suggesting hospitals may need to become more like the Cheesecake Factory.
Yes, I read that. Yeah.
He's talked about the cost pressures as well as the changes the healthcare law are having, and said many health systems share the goal of large-scale production line medicine. The way medical care is organized is changing because the way we pay for it is changing. You read the article. Does it ring true to you?
In general, it rings true. We should always try to standardize our care because what we look for is to do the best practice. But what I have to caution you, and what the article I think mentions a little later, human beings aren't all the same. Just like maybe the quality of the produce that you buy to make the dish may not be the same, and you have to adjust the dish accordingly. So too, the human body may be different one person to another. We know it is, and we have to adjust that care accordingly. Having said that, standardization is a good thing.
Yeah.
And having care quite consistent across the country is a good thing. You know, we've been working at that for a long time, but now the imperative is our payments for physicians and hospitals are going to be based more on the quality, and standardization will make it a better quality.
Is that real, that change? I hear so much talk, mostly from politicians, because I'm covering them all the time, about delivery system reform, and we're going to pay for quality, not quantity and everything. Is that getting down to the hospital level, to the doctor level, about decision-making and everything?
It's hitting both levels. So, for example, if as a physician I go to negotiate with Blue Cross, right now what they say to me is, here are certain quality standards. For example, checking the blood level on a diabetic or some other thing like that, that you must meet on every patient so many times a year, and then you get paid more for that particular thing. So we measure. You know, it was very difficult to measure these results before, and that's why the system didn't go there. But now that we have information technology systems that can do that automatically, we can move more there.
Do you think this is going to be the main way we attack costs? You've been vocal yourself about that costs are a real problem. It has to be addressed. It's a problem for employers and others. I know I hear it constantly. You hear it on the campaign trail as well. Do you see signs of hope that we could see some relief in terms of cost inflation in medicine?
So one of the big things that I see is if we provide the right care for the patient in the right setting, that will help us to reduce cost. And doctors' offices and hospitals are working together toward that. For example, how do we manage a chronic disease and keep the patient out of the emergency room?
Chronic disease being, for example?
Like diabetes or congestive heart failure. How do we manage that and keep the patient out of the hospital? So doctors and hospitals are working together. When patients get discharged with a certain diagnosis like congestive heart failure, hospitals are arranging that that patient be seen within so many days of discharge to help keep the patient in good condition so they don't come back to the hospital.
Mm-hmm. What's your take now? It's Supreme Court has spoken. The Affordable Care Act is, for now at least, it's the law of the land, and it's much more than people might realize than just the expansion of insurance coverage. There's a lot about how health care is delivered buried in there. Do you think it's going to be a good thing overall for the health care system, and do you see its effects already taking shape?
So yes, I will say, I think overall it will be good. Not everything in it do I agree with, but overall it will be good. And I believe that we are moving toward those goals as time goes on, no matter what in that bill right now. Just like when President Clinton tried to reform health care, it didn't go the way he wanted, but we did a lot of good things because we were anticipating that. And I think that's happening now.
So let's say if the Republicans came in and scaled back most of the law, are some of these changes that are going to continue either way because it's more about how healthcare works? Sometimes it sounds like that.
Yes, I believe that is true. If they scale it back, we won't get to the point where they want, but we will make great progress in that direction.
You work for Lifespan. First question I wanted to ask
Yes.
is, I remember when I was at Providence Business News, there was a reshuffle. You moved to the corporate level. You're now Senior Vice President of Community Health. I believe I got the
Yes.
title right.
Yes.
What is the job? What is that job? What's your work there?
So in the job for Senior Vice President of Community Health, I work with physicians in the community. So with the Medical Society, I have a liaison with different organizations like that, with the primary care community. I work with the community health centers. So I'm on the board of the Providence Community Health Centers, the Free Clinic. So care in the community as it relates to Lifespan. I have a second job, which I started over a year and a half ago attached to this, and that is Senior Vice President for Perioperative Services. And in that
I didn't
role,
even try to pronounce that.
in that role, I work at Newport, Rhode Island and Miriam, just to help manage any issues.
What's perioperative for people?
So it's from the time that you're deciding to have an operation till you go home, really.
So making sure the whole thing,
The whole
so it sounds like
continuum.
everything to make it seamless, from whether it's a
Right.
chronic disease or an operation, to have everyone talking to each other.
Right, so when a patient comes in before their operation for pre-admission testing, to the recovery room when we discharge patients from recovery room.
Are doctors resistant? Doctors are famously headstrong. They get into this because they're brilliant people. They know what they're doing. Are they okay with you coming in and saying, let's look at a checklist here? Are we turning on our numbers, or?
Well, it's very interesting. In the beginning, there is a resistance and stepping in on the territory. But when they see you're doing it for them, to help them do a better job and make their lives more enjoyable and make the whole system safer for the patients, they embrace it. At Rhode Island Hospital particularly, they really have led the way in patient safety in the operating room for the whole state of Rhode Island.
Lifespan's sort of the 800-pound gorilla of medicine in Rhode Island, and it's also one of the state's biggest employers. You've been part of the organization for a long time. You're at the highest levels there. How do you see Lifespan evolving in the coming years? What's the big picture of Lifespan right now? Do you feel it changing based on everything else going on in the healthcare industry?
Well, certainly. And again, we're looking at all aspects of the care of the patient in the hospital. But with Dr. Timothy Babineau as our new leader, our CEO of Lifespan, I see a lot of changes coming. Particularly, I believe we'll be out in the community more. We will be identifying and collaborating with physicians even more than we have in the past, because the physician in the private practice taking care of the patient is going to be the center of what's going on in healthcare. More than 50% of our work now is outpatient.
Really?
Yes. So only 50% of our work.
It's not all open heart procedures and things like
No,
dramatic
open heart
procedures.
procedures have gone down dramatically. That's why we had to put the two programs together, so that we had a big enough volume to make it a successful, from a quality point of view, program. And that is going quite well. But Dr. Babineau also, I believe, will be looking at more consolidation of clinical programs, which we have done with the open heart surgery program moving to Rhode Island Hospital. The cardiology program is at both hospitals, Miriam and Rhode Island, and it's quite extensive at both places. The surgery is only at Miriam. We also have a joint center at the Miriam Hospital, and recently they moved all of bariatric surgery to Miriam Hospital. So we're consolidating things on the different campuses to make most use of the facilities and to make it more convenient for the physicians doing the work, and so that we have stronger teams supporting those physicians.
All right, we have to take a break. When we come back, we'll talk more about healthcare, and we'll have her switch hats to her airport hat when we get back. Stick with us. You're watching Executive Suite. Welcome back to Executive Suite. I'm Ted Nesi. My guest this week, Dr. Kathleen Hittner. She's a Senior Vice President at the Lifespan Hospital Group and also the Chairwoman of the Rhode Island Airport Corporation. That's the quasi-public agency that runs TF Green Airport, and that's where I want to pivot to now in our conversation. Kevin Dillon, the veteran executive director of Rhode Island Airport Corporation, is left, and I believe there's a search going on for his replacement. How's that going right now?
Actually, it's going quite well. Of course, we were sad to lose Kevin, but it was time for him to move on to a new challenge. He likes the challenge. Once the runway got approved, he's ready to go do something else and let somebody else do that. Not to say we don't have our challenges at the airport, because now it's getting that runway done and attracting more service to the airport. The search is going very well. We have hired a firm that specifically deals in recruiting for airports. Meanwhile, we have an interim at the airport. I think you have met Peter Frazier, and he's doing a very good job. He's
well respected, I think, legal counsel.
He is our chief legal counsel, and he has done this job before 5 years ago when he was much less experienced. So between himself and Brian Shattle, our CFO, they're working very closely together to make things go smoothly, and it's been going very well.
Any idea how long it'll take to look?
I would say it will probably take 4 months. We've already had our meetings where we met with the person who's doing the search, and we've identified the kind of person we're looking for and what we want from that person in the future.
You mentioned challenges at the airport. There has been a big traffic drop in amid the recession at TF Green. I looked it up, 5.7 million passengers in 05, 3 million in 2011. What do you see as the cause there, and do you think it can be turned around?
So this is a national issue. I think if you look across the country, we're down 3 million passengers a year from what we were in our peak in just before 08. This is a national problem. And part of it is that the airlines are really cutting back on the routes that they run, but more importantly on the size of the airplane. So they cut back on the size, and they go for having as many passengers on board to fill that as possible. Most of our planes that leave TF Green are 90% plus full.
Yeah, last few times I fly, I was packed.
Very full. And they're not adding more planes. So that is an issue. The planes are smaller, and
so plane numbers might not be down as dramatically as the passenger numbers because of how many seats are on there.
That's exactly right. It's exactly right. But we will, I believe, see increases now that JetBlue will be coming, number one. And I believe when that runway is done, which will take a while, but the whole concept that we're going to do it is going to attract people to want to fly out of TF Green, because we're going to be able to go further and offer some other routes.
I have more questions about this, but I have to ask first, how did an anesthesiologist end up as chairwoman of the board?
That's a very good question. I was appointed to the board by Governor Almond some time ago. Then I was off. Then Governor Carcieri put me back on the airport board, and when an opening came up, he asked me to do it. And of course, I don't know a lot about airplanes, but what I do know, because of my experience at Miriam Hospital, is how to deal with neighbors. And there were a lot of neighborhood issues pertaining to the extension of the runway. And the governor felt that I would be better able to understand those issues and help the airport deal with those issues. So I was appointed more for my...
A diplomat.
Yes.
And a big victory for your management of the board just now that we finally have the Warwick City Council signing off. And now I admit, like a lot of people, I get confused about where things stand with the runway project, because for so long there were the arguments locally. Now I know it's mostly approved, but we're waiting for some things from FAA. Where do things stand? When might we see construction?
Actually, we just met with the FAA last week, and things are going very, very well. We have to do the safety overruns of the other runway first.
Okay.
So that will begin, we hope, very shortly. We have to do the planning. It takes so much time. It takes more time to do the architectural planning and the staging, because we got to keep the airport open while they're doing it. So that's taking time, but you will see it go. They assured us everything is in order, and we're ready to start doing things. We have to do things you can't even think about, such as moving some ball fields.
I remember hearing that.
Yes,
yeah, baseball fields.
yes. So we have things we have to do that isn't appreciated by the public, but we couldn't do any of that until we got the okay.
And do you have a projected date right now for when you hope it's finished and completed and you'll have a ribbon cutting?
Well, they tell me a date. I'm not happy with the date.
No.
It'll be 2017. But we're hoping we can move that up if we get other things done.
You mentioned
the safety extensions on the other runway is 2015.
Oh, okay.
So we have to stage everything.
You mentioned earlier, you hope that the runway expansion can increase traffic, and I can imagine someone at home saying, "Well, wait, if traffic is down, why do they need a bigger runway? Maybe they need a smaller runway because there aren't as many people going." How does that all fit together?
So there are stories about that I really want everybody to understand. It isn't just a bigger airplane taking off. Even the airplanes we have now taking off, if they're full, which we just discussed, they're full, and it's a very hot day, they have to unload some of those passengers because they don't have enough runway to take off. It also is a safety issue. But if we can get this done, when we get this done now, not if, when we get this done, we will have the ability to attract carriers who want to go other places maybe and use this as a different kind of hub. So for example, JetBlue that we talked about, they would love to go to Puerto Rico. San Juan is
so would I.
Yes, San Juan is one of theirs, but they got to make sure they have people who are going to want to use it, and they have to have a runway they feel.
And you're hopeful, JetBlue's starting with 3 flights, you're hopeful that could increase over time?
Oh yes, but we have to fill those flights. And if we combine those flights with the service we try to provide at the airport to make our customers happy, we'll fill those flights.
All right, well, an optimistic take on TF Green then. When we come back, we'll talk about Dr. Hittner's long career in Rhode Island and how she's seen things change in the workplace, especially for women. Stick with us. You're watching Executive Suite. Welcome back to Executive Suite. I'm Ted Macy. My guest this week, Dr. Kathleen Hittner, Lifespan Senior Vice President, and wears many other hats, one of them being, must disclose, my sponsor, the Rhode Island Foundation. You're on the board there, and one of your responsibilities is their program to attract more primary care physicians to Rhode Island and build that up. And there's a lot of discussion right now. Will there be enough primary care physicians to fill the new people gaining coverage with the Affordable Care Act? What's that program looking to do, and are you concerned about a shortage of primary care?
So first of all, I am concerned about a shortage of primary care. I have been for some time, and that's why I became active in trying to help with that. And one of the things that I did through the Rhode Island Foundation, aside from programs they already had in place, was to work with the medical school, the Warren Alpert Medical School,
Brown University, for those
with Rhode Island Foundation, and with Lifespan, to set up a program to try to help medical students get interested in primary care. And how we're doing that is by bringing in primary care physicians. We have 6 educational sessions to try to get them into what a curriculum should be like when the students are in their office. And then we also have a fund whereby we pay the primary care physician for some of the time, just a small stipend, but nonetheless something. So the 3 of us did that. But the Rhode Island Foundation has loan forgiveness programs and other programs to try to encourage primary care physicians to come to Rhode Island. We're trying to get the medical school to get their students interested in going into primary care.
Keep them on that beautiful new building down they have too. I'm wondering if you're talking to a medical student right now, I hear, and Atul Gawande, who we mentioned earlier, has done a lot of good work on this. It can be very stressful to be a doctor. You're compensated well, but a lot of people go into specialties because they can control their schedules, and there's all the red tape of insurance. I mean, do you tell them it's worth it? What makes it worth it to become a doctor?
Oh, it's absolutely worth it. I wanted to be a doctor since I was 9 years old, and I've always enjoyed my career thoroughly. First of all, it's a fantastic education. To go through medical school and training is just wonderful. And you do so much good for so many people. I can't tell you how many people in the middle of the night with an appendix rupture or something. I'm an anesthesiologist. You can't do the operation without me,
right.
so it makes you feel like you've really accomplished something good and helped people. And I don't practice medicine anymore, but I believe I'm helping as many people by doing these other community things that we talked about in the medical field.
We had Liz Roberts, Lieutenant Governor Roberts, I should say, on Newsmakers a few weeks back. We were talking about healthcare, of course, a big initiative for her, and she said one of the reasons she has high hopes for what's happening now is she sees a lot of new leadership and new thinking across the community of healthcare in Rhode Island, with Peter Andruskowitz, I think I said that right, at Blue Cross, Tim Babineau taking over at Lifespan. And do you think, is there a coming together among stakeholders right now about what we need to do to try to make healthcare work better in Rhode Island?
So I think the stakeholders are talking more than they ever did before. I think a lot of the initiatives at Blue Cross, particularly around the patient-centered medical home and working with primary care physicians, has gone a long way to improve the relationships of physicians with Blue Cross Blue Shield.
Which can be tense and have been at times.
We need to come together more, and we are working on that. We have new leadership at Care New England also, with Mr. Keefe, who has a great deal of experience and a nice, new, refreshing approach.
Care New England, for people at home, parent of women and infants, among other hospitals.
Yes, Butler and Kent.
You know them well. I want to talk again about your own career. You've been a pathbreaker professionally in Rhode Island. I was looking at the long list. First woman president of the Rhode Island Medical Society, Rhode Island Woman of the Year in 2009, the first woman physician to lead Miriam, Businesswoman of the Year in 2006. You're in the Rhode Island Commodores, which every reporter desperately wants to get into if you ever get that discussion going. I'm wondering how you got it. I believe 1979 you started practicing medicine. How have you seen the position of women in the workplace change over that time? Is it very different today? Yes,
it's very different. You know, I finished medical school in 1973. Of the class of 60, I think 4 women finished. Wow. If you look at the medical school at Brown today, 50% or more of the students are women. So the ratios have changed. The workplace has changed. Part of that has been the mandated resident hours by the accrediting bodies, so you can't work more than 80 hours a week or something like that. And every year they decrease that, so they have rested physicians that are more safe in their opinion.
Unexhausted, yeah.
So the workplace has changed dramatically, and I think that enables women to participate more than it did before. So we see many more.
What are the challenges today, do you think, for women? Undoubtedly, there are still different challenges for women in leadership positions, especially at the high levels as you've gotten to. I mean, what do you think, what would you tell if someone came to you and said, what policies should we be looking at, or how can workplaces make sure they're supporting women to advance as far as you have in your own career?
So I had a very different background and a very different way of coming up. In my day, when I was coming up the ranks, I made it a point not to participate in women's organizations and not to go to all women meetings, because I felt I was in a man's workplace and I needed to work with men on a regular basis. I think it's very different today. I think it's very important to share your ideas with other women on what has made you successful. No substitute for hard work. The biggest thing I felt in my career that got me ahead was to raise my hand and volunteer, be the one to do any job that needed to be done, and get it done. And I think time is really important. I never had children, so I had more time than most women have, but it's very important to volunteer because you get to learn all aspects of the job by doing that.
We only have about 30 seconds left, and I have a silly question for you, but do you ever watch TV hospital shows like ER, Grey's Anatomy, or them?
Never.
Never? Have you ever watched them at all?
Well, I may have watched 1 or 2 and decided it was just...
Didn't look like the hospitals you knew and work in?
No, and I'd rather watch something more entertaining than what I'm doing all day long.
That's true. Maybe it's like I sometimes watch the newsroom and I'm like, oh, it feels like I was at work today. All right, well, Dr. Hittner, thank you so much for being with me today, and I want to thank you for watching Executive Suite. If you missed any of this show or any other episode, you can catch it on our website, WPRI.com. Tune in every week here on MyRI TV. We'll see you next week here on Executive Suite.